Your most common Botox questions answered. I posted a video yesterday of me doing my own botulinum toxin injections, and y'all had a lot of questions, so let's answer them. Number one, does it hurt and did you numb? I didn't put any sort of topical numbing or anything on beforehand, and I don't think I've ever done that for anyone for Botox. It does feel like a little tiny needle going into the skin, but I mean, it's really bearable. Number two, how long does it last? I found that this could vary from person to person, but most of the toxins, when injected into the upper face, like I was doing for cosmetic reasons, last about 2.5 to 4 months. And I really do feel that people usually come to the 3-month mark before they get all of their movement back. What I used was Daxify, which it's my first time using it. The company that makes it says that it could last up to 6 months, so I'm interested to see how that turns out. That said, even though the muscle relaxation effect may wear off in that amount of time, the results as far as decreased expression lines can last longer, and I found that in my case, like it even after all of my movement comes back, it takes a while for the lines to return. When is a good time to start getting botulinum toxin? A lot of people look for me to say a certain age, but really it depends on the person. In this case, we're using these toxins to treat expression lines. So those are lines that form from repetitive facial expressions. So if those lines are starting to show a little bit at rest, that's a good time to start. If that happens for somebody at 25, they're a good candidate. If somebody's 50 or 60 and doesn't have those lines, I would not use toxins on them for that purpose. A lot of people also asked me about a Botox brow lift. So it's possible to do a lot with toxins to alter the placement of the brows. I was talking about not creating an arch for myself by injecting out to the side, but if you do want to create a little bit more of an arched lateral brow, you do that by where you place the toxin. Another thing that you can do that I do sometimes is to put a few units towards the tail of the brow. So this is injecting part of a muscle called orbicularis oculi that goes all the way around the eye. We really use that when we're closing our eyes tightly like this. That muscle is partially responsible for brow depression. So by weakening it at the tail of the brow, it does give a little bit of elevation and more of an open eye look, but it tends to be subtle. You really can't inject a lot of toxin in this area because it could create issues if it spreads, but it is something that I use sometimes. A lot of people who have had toxins injected before talked about the crunch. With either botulinum toxin or fillers, you can hear a fair bit of like popping or crunching when the injections are happening. There are a lot of layers of tissue on our skull, and when you're essentially putting some sort of volume between some of those layers, there is going to be a little bit of them spreading apart, and what you're hearing is those sounds transmitted via vibration of your skull to your hearing. It is normal. I've heard some derms call it like Rice Krispies. I've noticed that it actually happens more with filler because you tend to be placing more volume, and in a lot of cases you're putting it right on bone, so there's a lot of transmission of the sound. We also have people asking about like how to find a good injector. Sadly, like it's not the easiest thing to figure out just because so many different people with so many different types of certifications are able to inject now. Do I think that you need to be going to specifically a dermatologist or a plastic surgeon to do these procedures? No, there are other health professionals that if they have like a lot of training and a lot of experience will be great. I think it's important to just ask whoever you're going to about their experience, what their approach is, how long they've been doing it. I think that's probably the best indicator of how well they can do. I think also they should be counseling you about potential side effects and what could go wrong, and ask them about what could go wrong and what they'll do if something does go wrong, because I think that's really the most important thing. Obviously, if you want to play it as safe as possible, there are cosmetic dermatologists and plastic surgeons that do this stuff. It may cost a little bit more, but each and every individual person has to decide the cost of their peace of mind. But again, there are a lot of nurse practitioners, PAs, etc. out there who are great at this stuff and have a lot of experience. What other questions do you have about botulinum toxins? Let me know in the comments.